Hey guys, welcome back to my channel. My name is Sonia. Today I have a topic on limerence, a bit of retroactive jealousy as well as therapy that I would like to kind of talk about with you guys because therapy is a very big part of some of our lives and also is a possible option that you may want to consider if you are healing from limerence. Okay, so this is actually a story from a potential client that I was speaking to late last year. Um, there are a couple of things about his situation that I would like to point out and that I would like to kind of talk to you guys because you may be feeling or going through the exact same thing. So I've kind of cut out a lot of his story because a lot of it was pretty personal and I won't be sharing it, but is okay with me sharing parts of what he went through. So Jake, which is not his real name, he has admitted to, suffering from retroactive jealousy and limerence for a while now. So that was why he came to me. And he said that his partner recently left him, and in trying to heal, all these, he's been trying a couple of different kinds of therapy, so CBT, a few others, but he can't seem to move forward. So he always finds himself like in this like limerent state all the time, and always retroactively jealous about his partner's relationships, past relationships, and he has admitted to also suffering from it in all his relationships. So every single romantic relationship had retroactive jealousy and limerence appear at some point in time. So other details that Jake also shared with me, and this was only revealed to me when we were having our sessions. So I had a pre-consulting, pre-coaching sessions with him over a couple of weeks actually, because I wasn't really very sure what he wanted to get out of the coaching session. So it was apparent to me after a while that Jake is not really very aware of what he wanted to solve or what his intention was. It was after a couple of discussions where it kind of became pretty clear to the both of us that he wanted to remain limerent, which is not the point of why I help people in my coaching work or in my work with limerent individuals. Because, as you know, my stance on limerence is pretty clear. I am not someone who is for limerence. If you are someone who wants to, heal yourself, you want to experience love in a reciprocal, healthy manner, being in a limerent state is not the way to get there. Okay. Um, if you want love in your life, staying limerent would be the last thing that you want to be doing. But it was not very apparent to me that Jake wanted to actually stop being limerent. It seemed like he just wanted to stay in that space and was looking for a little bit of validation for why he should continue being limerent. And that is not the point of my work. Okay, and I also noticed a lack of self-awareness in general through all our sessions. Wasn't There was an inability actually to really articulate exactly what was going on, what were the possible sources of limerence, what were the possible things that actually led to him being in this particular situation. It was a lot of vagueness, and um I felt very muddled after our sessions together. Okay, and there was also a sense that he wanted to quickly start consultations or start coaching, the main coaching sessions, to kind of quickly get over limerence, okay, and jealousy. So there was a sense of wanting to seek very quick fix solutions, immediately. And I wanted to cure immediately. Although I've said this many times before, in many of my videos as well, limerence healing is a journey, okay? Because you need to really, it involves a lot of work of going into your childhood, going to your past, undoing beliefs, undoing cognitive patterns, undoing habits, undoing things that you have been used to doing, thinking, and believing for many, many years. It's about building a relationship with yourself, which takes many, many years because so many of us are just not great at building a relationship with ourselves. We have never been taught to, we have never been socialized that putting ourselves is important. Okay, so building a relationship, knowing what is self trust, what is self love, what is self esteem is so foreign to so many of us. And all these types of work actually take time. And that's not even getting to the part where, you start to kind of condition yourself to looking out for healthy love, to, to date healthily. It's not even getting there yet. So there's quite a bit of work to do, and you have to be willing to do the work, I feel. It took me a couple of years, okay, years. I'm not saying that you will never be able, like, you will never take weeks to get over limerence, but you have been limerent for many, many years, and I was like more than a decade. And mine started in childhood, like Jake's as well. It's very tough. I wouldn't say it's impossible, but there's a lot of things you need to undo and unpack. So it's not like, hey, I give you a couple of strategies and you're going to heal from limerence, by the end of this week. It doesn't work that way. So whenever we have, heavy situations they're dealing with, I wouldn't say, okay, not heavy, but like slightly, more things to kind of deal with, like in limerence, quick fix solutions don't work. Okay, you will find that they work for maybe a couple hours, couple of days, maybe a few weeks, and then you'll go back to your old patterns again. um there were also some attitude or behavioral issues that he actually kind of admitted to, because he was drinking a lot and had addiction to, I think, slight addiction to alcohol. And he had some altercations and some fights and assaults with his limerent, his colleagues, which involved his limerent object as well, because his limerent object was his colleague. Um, and at the end of the day, I just couldn't accept him as a client because there was really no desire to move on from the situation. Okay. And there are a couple of things about Jake's situation that I really, really want to unpack and I really, really want to talk about. Okay, so here are the couple of things. Firstly, thoughts on therapy. Okay, just general thoughts on therapy and what we could be looking for when we are looking for therapy, a good therapist in our hometown. Secondly, I want to talk about therapy in the context of limerence and why sometimes it doesn't work. Number three, are you really determined to cure from limerence? Okay, golden question, and most people cannot really give me a proper answer, which is something that I will talk about later. The last one, are you willing to form a better relationship with yourself? A very, very big deal. And also, some people do not want to. Okay, it's counterintuitive, but I know that there are reasons for doing so. Okay, so let me just kind of touch on some general thoughts on therapy first. Let me just say, okay, that I've been to therapy. I actually cured my limerence without therapy because, to me, therapy in my country and my hometown, where mental health is not like, it hasn't been a big thing in the culture here, until the recent like couple of years because of COVID and with people struggling a lot with different things at home. Um, I would say that the therapy, like um the field is not developed at all in my country, and it could be the same for where you're from. So this is why therapy can be like sometimes a hit or miss for many people, because having a developed established field of therapy or therapists for a population to actually tap on takes a lot of time to actually build up. And good therapy, good therapists, okay, it depends on a lot of factors, okay. And to me, good therapists are sometimes really hard to find. So when you find a good therapist, please stay on with them, okay, because it requires a lot of trial and error, to find someone good. And therapy is not cheap. Okay, it's really expensive in my country, and in order to actually stay on with a specific therapist, you actually have to pay a premium. Okay, and most people cannot afford that. And the people that really need the therapy sometimes are unable to actually afford the session. Okay, I know societal issues. So finding a good therapist is tough, okay, because there's so many factors. Okay, you have to kind of look at the dynamics between you and your therapist. Some therapists have, they have different styles. Okay, some of them are very tough love, some are very nurturing, some just they just love to ask you questions and guide you to a particular solution, but not give you any answers. um there are different styles, different styles and different fields of therapy. There's CBT, there is solution based therapy, there is emotions focused therapy, there is rational therapy, so many different types. And it's very difficult sometimes to assess as an individual which type actually suits you better. And for me, uh therapy is a space where I actually go, psychologically safe space where I go to talk about my issues, and I'm offered a semblance of some solutions. I'm not looking for solutions, but I'm looking for, like, areas where I've kind of blocked out solutions because I've been so narrowly focused on a particular area. So therapy helps me to see the blind spots in my own thinking. And I need a therapist that actually does that for me. So a therapist who is just like, hey, these are the solutions, go figure, go do them or go figure it out yourself. Those styles don't really work very well for me, but they do work for some other people. So you need to be able to suss that out. And sometimes sussing that out itself is not just based on the therapist, it is also based on how well you know yourself and what kind of style you actually respond to. Because sometimes, we go through so many therapists and so many sessions, and we're actually not responding to a therapy because we just don't really like their style and we're not aware of it. So it takes some time, for trial and error. So it can be a real hit or miss, and some people actually feel even more traumatized after seeing a therapist because yeah, because some therapists are really honestly not very good. Okay, so it really takes some time. And another issue with therapy is that many people go into therapy hoping for a quick fix. Okay, they expect the therapist to like give them solutions on that day. They start doing those things the next day, and then within the week is fine. It doesn't work that way. Okay, it really doesn't work that way. Any work that you do on yourself or any healing that you do is a journey. Okay, always remember that it's a continuous journey. It doesn't stop. So you got to be willing to do the work yourself and on yourself. Okay. There is actually such a thing as treatment resistant. Okay, and so some people are just don't respond to therapy that well. And what I kind of want to say is that, it could be sometimes a perspective as well about therapy. A therapist can actually motivate you. They can give you some tools. They can ask you certain questions to change your thinking. Um, but it's not a band-aid or an overnight solution that will turn your life around. So if you're going in and expecting your life to be turned around within like a couple of days or weeks, it sometimes is yeah, some adjustment of expectations is required here. Okay, so that's the first thing about therapy. What about, therapy in the context of limerence? So, okay, therapy as a field is not ready for limerence yet. Okay, because I have a lot of clients coming to me and saying, like, oh, they have gone to so many therapists and counselors and nobody understands what they're talking about. So, when therapy as a field is not really, in the space where they are kind of, healing limerence, so to speak. They may be offering you solutions that are not really helping your situation. Okay, and limerence is very dynamic, as you know, limerence and retroactive jealousy, which is the other thing that Jake brought up. They're very new areas of therapy. Many people are not equipped to handle these cases. Okay, and limerence and RJ, they are very emotional in nature. I remember going to a therapist many years ago, and this person kind of just was puzzled that I was behaving this way. And they said like, oh, you can just stop thinking about the celebrity. Like, why do you keep having to think about him? Um, so it's not just the thoughts, or thinking about person. There's so much that is going on underneath. So limerence and retroactive jealousy, they're very emotional in nature. With ties to how the brain functions. There's childhood trauma. There is, you know, faulty wiring of love, and how love is like poor role modeling for love. So many social, environmental, and neuroscientific sources that can actually contribute to a person being limerent, and all these areas have to be dealt with sufficiently, especially in the very serious cases of limerence. So this is also the reason why I find that many cognitive approaches don't really work. Okay, so CBT or anything similar, they do not really treat the emotional nature of limerence and retroactive jealousy accurately, because a lot of limerence involves the brain. It involves things like addiction, obsession, and it's very emotions based. Okay, and another thing is that with limerent individuals, and you may resonate with this, is that we already feel a lot of shame and guilt. Being limerent. Imagine going and I couldn't even tell my friends last time that I was limerent because I didn't even have the word for it, but I just felt really embarrassed talking about it. So imagine having to go there, to therapy, and then, expressing, telling a person that you are obsessed with someone for many times. It can be very difficult to verbalize that to a stranger, okay, especially if rapport hasn't been built or it hasn't been built well. Okay, and sometimes, okay, and this is what I mentioned earlier, there is such a thing as treatment resistant. Okay, this is happens in certain fields of mental health, and there are scientific articles published about it where scientists and psychotherapists they have found out that certain individuals or clients cannot be treated on some level. Okay, they either resist the treatment, they don't respond to it, um and is something that no matter like it's kind of like no matter where they go for their therapy they just don't respond well to it. So it has been an increasing phenomenon that the field has been starting to recognize over the past couple of years. um and sometimes uh going back to the point on limerence, is that limerence and retroactive jealousy even is, it kind of looks like what is going on the outside is could be a hint of something else that is present that is much deeper and much the issue is a little bit more, it requires a lot to unpack. Okay, because like when I went to my therapist many years ago about the celeb thing, she just thought that I was just this very overzealous fangirl, who couldn't be bothered with her studies and her homework, but was always talking about this particular male celeb. I can't even remember who. Oh my gosh, that I was interested in at that time. So she was just like, just forget about him. Just don't think about him. Just go do your homework. But yeah, I can't do my homework. Because I keep thinking about him, and that was what was happening on the outside. But actually, on the inside, I was going through a lot of stuff. I had unhealed, childhood stuff. I had, a lot of stuff around abandonment and rejection and sense of belonging that was kind of in my psychological space, but which I wasn't aware of. I had a lot of issues with anxiety when I was younger as well, and was obsessed with being perfect. The perfect person for a potential lover. There's no such thing, right? So limerence sometimes points to very underlying factors that need to be treated first before you can deal with the limerence and the retroactive jealousy issues, because there's so much of stuff underneath. It could be depression, it could be addiction, it could be OCD, it could be childhood trauma. So then you're not just going to therapy for limerence, you actually could be going to therapy to actually heal the trauma, because once you heal the root, you find that the limerence starts to go away. So that's the thing, therapy, possibly as a field is not really very ready for limerence yet. Okay, I always forget where I put these slides in my deck, but okay, there are a couple of resources that I have. One on the left, the pink one is a book, and the next one, the blue one, is a workshop that I conducted earlier last year. Um, the book has all the different sources, socio-economic, a neuroscientific factors for why we actually turn out limerent, and some strategies that you can start using. But again, remember, a reminder, gentle reminder that, um, we all take time, okay, to heal. So, but it's a start. Okay, the book is a start. And if you want anything on emotional unavailability and love and limerence, the workshop kind of answers that. So it's all linked in the description box below. I'll just move on to the next point. So this is a very big one. Okay, you gotta be really determined to cure from limerence. Okay, I've said this time and time again. But if you want to cure from it, you got to be really determined to, okay, and really want it for yourself. You got to really want to let go of it. Okay, so I talk about the reasons why, some people remain limerent in another post, which I'll link to down below. But the biggest reason I see is that a lot of people just don't want to stop being limerent. I know it sounds weird, you'll be like, yeah, but why people don't want to cure? Because limerent is so addictive. It's like a fantasy that you have of this person who is in love with you. It all exists in your head. You can do whatever you want with this fantasy. You can have zillions of episodes. You can introduce different characters. You can have different, have your limerent object have different qualities in your fantasy, but it's not reality, right? And a lot of people always come and tell me like, hey Sonia, I'm really really like, I really want to let go of limerence. But on the other hand, they're still repeating the same things, over and over again, the same habits. They can't pull themselves away from Instagram. They keep checking, their limerent objects page. They keep fantasizing about limerent object instead of doing their work or whatever it is. So there needs to be really a point where you reach, internally for you, where you're like, I really want to stop living like this. That is your turning point. That was the turning point for me. Okay. After all those years of like, I need to give this up, I need to give this up, it came to this point where I'm like, I really need to stop living like this because I'm wasting so much of my life away. That was my turning point. So you need to figure out where your turning point is and, use that to get you on the healing journey. When you reach your turning point, that's the only point where you start making inroads towards recovery and a better relationship with yourself and with someone else. Okay, because limerence is a very emotions um based issue or situation. So once you start acknowledging that you have this range of emotions that you experience, it's easier to kind of identify how differently you are as a person when you're limerent and when you're not. Okay. And a little story I want to share is, I do observe because so many people come to me for limerence and so many people are on my newsletter as well, which, maybe I'll link down below as well. Um, on my newsletter for limerence as well. And, different people buy my books and come to me for coaching. This, I do notice a difference between the behaviors of certain of my readers and clients. Okay. So there's a very small group of people that are very, very, very determined and very keen to stop being limerent. Or those are the people that will be very engaged with my newsletters. They actually buy my books and my workshops, okay? And they also come to me for coaching. So those are the people that really, really want to cure. They really want to determine to get over this. And the difference in the behavior is very stark because the rest of the people are like, okay, yeah, I'm limerent, but I want to continue being limerent. Okay, yeah, I'm limerent, and yeah, maybe I want to get better, but yeah, I'm just not really very interested. So different behaviors. Okay, so what I'm saying is that when you actually reach that stage where you really want to heal, your behavior takes on a more urgent and a more specific and determined quality to it. So it's figuring out your turning point. And the next point, okay, so more resources for you. Go check them out. So one is on building self-awareness, and one is a breaking free from your toxic patterns in limerence. Okay, it's linked down below. My very last point, okay, is on working on yourself. Okay, because ultimately, as with anything in life, one of the biggest cures is actually to learn to connect better with yourself. When you're connected with who you are, your essence, your values, you're able to trust and accept yourself wholeheartedly. You find yourself less attached to people, situations, and outcomes. And limerence is ultimately an attachment to a feeling or a person because you want a desired outcome. Usually it is love. Okay, but when you have a healthy attachment or connection with you are able to seek out healthier ways of love. So you do need to want to at some point start to work on bettering the relationship that you have with yourself. I'm very, very huge on the work on yourself because self is power, self knowledge is power. When you know yourself so well, when you know yourself inside out, your values, your dislikes, your likes, whatever it is, nobody can take that away from you. Okay, people can be 100 million people can be telling you what to do and you will be like, nah, I'm not interested. Okay, that's how you create a confident, positive self that lives for your spiritual growth. Okay, and when you start to build, self trust or self esteem or self love and things like that, you'll find yourself actually showing up very differently in love. I mean, in life, in love and life, yes. Love is part of life, so you'll find yourself showing up very differently. Okay, when you are limerent versus when you are in love with someone, and when you have a healthy sense of self, because usually limerent individuals we do not really have a very healthy self concept of the self. Okay, when we kind of show up in life, it's very different. We when we are limerent, we show up in a very kind of like limited, very small way. But when we are in love, it's different. Okay. Um. Yeah. So these are the couple of things that I actually really want to unpack about Jake's situation. And again, more resources for you for self love and self esteem if you're interested in building that is in the description. Um, Coming back to Jake's situation a bit, and also tapping on my limerence relief model, where there are three parts to it. So you diagnose why you're limerent, you heal yourself, which is what I was talking about just now about the self, and then you start living and loving very happily. So for Jake, the diagnosis part, and if you somehow resonate with Jake's story, the diagnosis part, sorry, you have to really figure out why you're limerent. You got to really determine that you want to change, that you want to heal, that you want to come out of limerence. That's when you can start to really heal yourself because that's when you start to build a stronger relationship with yourself in stage two. Okay, and when you have limerence is out of your life, your self concept has grown so strong, you'll find that you are attracted to people or you start to attract love that is very healthy, that is very, very good for you. And it's not something that makes you feel even worse about yourself. Okay. So this is usually the process that I used to work with my clients. So if you are interested in working together with me, I have some more details in the next two slides. This is just a summary of the resources that I have in my description box. But if you'd like to work with me, I do have email sessions now at a very heavily discounted price. It is at $29 per session. If you want more sessions, just let me know. We'll work out a package together. Um, and yeah, and we'll just talk about what you're going through. So I'm wishing you the very best in your healing journey. Remember, it is a journey. Okay, it is not some sprint. You don't get solutions in your head, or buy my book with the strategies and then start working on it tomorrow, and you are healed by Saturday. It doesn't work like that. um Give yourself time and space to kind of take on the solutions. Okay, growth occurs sometimes when you're not looking. And when you notice your turning point, when you know when your turning point is and you're ready to let go, that is a path that will move you through your healing journey at a much faster pace. Okay, so I wishing you the best. Do not give up on yourself. Okay, we are all in this together, and if I can heal, so can you. And I'm wishing you the best. So take care, and I will talk to you very soon in the next video.